Every day I meet people who have been under treatment by their physiotherapist, by their chiropractor, by their osteopath, without seeing any durable improvement to the condition. In this video, I want to give you some clear criteria, almost an algorithm, to understand if your therapist is doing enough for you. The goal is, of course, not to blame individual therapists who do their best to help you. It is to empower you to know if following this treatment is enough or if you need to do more. Welcome, I'm Olivier Girard, ergonomist, posture therapist, author of the Posture Manual, and creator of 3 online posture programs. I'm going to start with a metaphor. It's a simple one, but you'll see that it's extremely relevant and actually precise at the same time. Look at this child. This child has a dirty mouth. It's now bedtime. What do you want to do before bringing him to bed? Well, you want to clean his mouth. So if you look at this picture, you go to the bathroom, you take a wet towel, and you wipe off his mouth. Now, take a bit of distance and look at this second picture. What do you now want to do? Now you want to remove the ice cream from his hands before you clean the mouth, because otherwise you clean the mouth and next thing you know is that the mouth is dirty again. Well, here with this simple example, I have showed you how to take a different approach for accidents. That's when you see only the dirty mouth. And for overuse, that's when you realize that there's ice cream in his hand. You see, when you have an accident, dealing with the symptoms, i.e. the consequences, i.e. the dirty mouth, is enough because the causes are gone. But if we're facing overuse, the causes are still present in your daily life. So how to differentiate between accident and overuse? An accident is a sudden event, so you should be able to give a date and a time that generates sufficient force for having the effects that you blame it for. In other words, I'm here talking about I did the wrong movement. I did the wrong movement and therefore I blew my disc and got a disc hernia. Wait a sec, that's not enough, because this wrong movement, say lift your child, lift your PC, garden for 2 hours, is actually something that you have done many other times before without any consequence. So you see that the event per se is not enough to justify the condition. Therefore, we're not talking about an accident, we're talking about the last drop, the drop that makes the glass overflow. And overflow is accumulation, is cumulative disorder, is overuse, you name it, but that's not an accident. Let's now talk about the strategy that you need to adopt when you conclude that you're facing overuse. Well, the strategy that you should adopt is, of course, you can get symptomatic treatment because it feels good and there's no harm in feeling good. But unless you remove the ice cream, things will be perpetuated. And removing the ice cream means dealing with the oil that you put on the fire. What is oil on the fire? It's 2 things, biomechanics and psyche. Yeah? Psyche means stress. And biomechanics is one of 2 things. Is biomechanics, the impact of biomechanics that the rest of the world has on your body. And this we could put under the big umbrella ergonomics. And it's next to that biomechanics from within, i.e. what your habits, what your posture does to yourself, and that is what we put under the umbrella word posture therapy. Hence, dealing with the causes of overuse is dealing with ergonomics, with posture therapy, and with stress. Let me give you a rough criteria to know if you're properly or adequately dealing with one of these 3, ergonomics, posture therapy, and stress management. These 3 share one common feature, is that you are the actor, you are the therapist. And these are what I call hands-off approaches. From the moment someone touches you, he or she is not dealing with these 3. He or she is dealing with the symptoms. So any therapist who touches you, treats you, like you would have an accident. And if this is enough, well, you need to be able to give the date and the time when a sudden event happened that generated enough force to justify that the effects that you are being treated for. Unless you're able to do that, you can consider that you're dealing with overuse, and therefore next to symptomatic treatment that feels good, you need hands-off approaches. To be super accurate, we should actually recognize that there is a third possibility for you to feel pain, which is illness, disease. Say, for example, Scheuermann disease, something that you were born with or that, say, you developed with the age. Can be a tumor, can be something. Yeah. In that case, the approach is kind of the same as with overuse. There is symptomatic treatment in the hands of medical doctors, so trying to do as much as possible to deal with the symptoms. And next to that, you should make sure that you don't aggravate the situation by not putting oil on the fire. So say, for example, if you have Scheuermann disease, which leads you to going like this, because your vertebrae are wedge-shaped instead of being kind of cubic shape or cylindrical shape. Yeah? Next to having symptomatic treatment to release muscle tension and all that, you need to make sure, that's ergonomics, that, for example, your keyboard is not too far forward. Posture therapy, you need to make sure that you stretch your chest and reinforce your lower trapezius to compensate for this forward imbalance. And you need to deal with stress management, which is not my job, by the way, because as soon as you're a bit depressed, you're going to be like this, and therefore feed Scheuermann disease, which per se has nothing to do with depression, but which may be sped up by depression. And you see, to be 100% clear, the current medical and paramedical paradigm is a hands-on paradigm. Most medics and paramedics out there are not good coaches. They are not trained at coaching you, and therefore they have a hands-on approach, which is the approach that is suited for accidents. But most of you guys suffer from overuse, from things that are only created by what you do with your body and your mind day in, day out. And this is why whenever you have a therapist putting his or her hands on you, you should be happy but not satisfied. That's not enough, and you need to seek something else. Sometimes it's true that you can have an interconnection between these three. Say, for example, after an accident, due to the pain, you enter a cycle of overuse. Or due to a disease, say Scheuermann disease, you create something which is of the overuse family. But due to overuse, say pain for example, you could trip, fall, and that's called an accident. So there might be relationships between these three things, but you need to treat them as separate problems if you want to be effective. At psychological level, I cannot help you. If you need help with biomechanics, either posture therapy or ergonomics or both actually, well, there are many ways, this YouTube channel being one of them, the online posture programs being another one of them. The fact that I will help you at a distance is a clear indicator of a hands-off treatment, and therefore a treatment of the causes, not the symptoms. There's always a downturn though, which is that you have to do the job, my friend. In the hands-off approaches, you're the actor, i.e. you sweat. If you found this useful, well, let me know below, register to this channel, and please share this video because many people out there haven't their mind so clear on this topic.